Have you ever noticed your eye suddenly becoming red, irritated, and maybe a little sore? Perhaps it's not just that tired, dry eye feeling after staring at a screen all day, but something deeper, something that makes you wonder if it's more serious. You start thinking, is it an infection? Is my vision at risk? The redness makes you self-conscious, the soreness is distracting, and all you want is for your eye to go back to normal. What if I told you there's a common eye condition that might explain what you're experiencing, and it's called episcleritis? If you've never heard of it, don't worry, you're not alone. Many people suffer from episcleritis without realizing what it is, and although it might sound alarming, understanding it can put your mind at ease. So, let's break it down. What is episcleritis? At its core, episcleritis is the inflammation of the episclera, a thin layer of tissue in your eye. Now, before you start worrying that this is something dangerous or permanent, here's some good news. Episcleritis doesn't usually affect your vision. That's right, your vision stays intact. But why does it happen, and why does it feel so irritating? Think of your eye as a multi-layered system. There's the sclera, the white, firm part of your eye. Then there's the conjunctiva, the transparent membrane that covers the eye's surface. And in between these two layers, lies the episclera. It's thin, and it's filled with blood vessels that nourish your eye, sort of like the irrigation system for a garden. When the episclera gets inflamed, it leads to that frustrating redness and discomfort. It's not just a little burst blood vessel, it's a reaction that can feel tender, sore, and sometimes even sensitive to light. This inflammation could affect a single part of the eye, or it might spread across the whole thing. Why does this happen? Here's the tricky part. Often, doctors don't know why episcleritis happens. It's what's called idiopathic, meaning it just happens without a clear reason. Maybe you woke up one day, and your eye felt off. Sometimes, it might be related to a larger condition, something that causes inflammation throughout your body, like arthritis, or other autoimmune diseases. But many times, it simply shows up out of nowhere, and that can be frustrating. If you've ever dealt with inflammation elsewhere in your body, whether it's a swollen joint or a sore throat, then you know the drill. Your body's immune system is reacting to something, even if you can't always figure out what triggered it. The difference between episcleritis, scleritis, and conjunctivitis. One thing that can make episcleritis confusing is how it gets lumped in with other eye conditions. You've probably heard of conjunctivitis, or pink eye. That's inflammation too, but it affects the conjunctiva, not the episclera. It's usually caused by an infection or an allergic reaction, and it's contagious. Episcleritis isn't. And then there's scleritis, which involves the sclera itself. Scleritis is much more painful than episcleritis, and it can affect your vision. It's like episcleritis' meaner, more serious cousin. If you're experiencing severe pain or vision problems, it could be a sign of scleritis, and that's something you don't want to ignore. Common symptoms of episcleritis. Now, let's get specific about what episcleritis feels like. The most common symptom? Redness. It's that telltale sign when you look in the mirror and see one part of your eye or maybe the whole eye flushed with color. The redness isn't just an irritation on the surface, it's a sign that the blood vessels in the episclera are dilating, sending more blood to the area. Besides the redness, you might notice mild pain or tenderness, especially when you touch the eye. Sensitivity to light, which can make stepping outside on a sunny day or sitting in front of a bright screen uncomfortable. Watering or tearing of the eye, adding to the discomfort. Most often, episcleritis shows up in just one eye, though it can affect both. It doesn't usually interfere with your vision, which is a major relief. But the discomfort and redness can last for days or even weeks before disappearing, sometimes only to return again later. How is episcleritis diagnosed? If you're dealing with an irritated, red eye that's been hanging around longer than you'd like, it's a good idea to visit your eye doctor. The key tool they'll use to diagnose episcleritis is something called a slit lamp. Imagine a bright light and a microscope combined into one device. You'll sit in front of it, rest your chin on a little platform, and the doctor will shine a narrow, intense beam of light into your eye. This lets them take a super detailed look at the structures in your eye to see exactly what's inflamed. During the exam, the doctor might also use eye drops to dilate your pupils, which helps them get an even better view. It's not a painful test, but it can be uncomfortable. Plus, once your pupils are dilated, you'll be extra sensitive to light for a few hours afterward, so you'll want to avoid driving or spending too much time outside. Treating episcleritis. Here's the thing about episcleritis: in many cases, it resolves on its own. It can last a few days or up to 2 weeks, but it typically fades away without causing any long-term damage. However, if the symptoms are really bothering you, whether it's the persistent redness or the discomfort, you do have options. Here are some common treatments. 1. Artificial tears. These can soothe irritation and help with dryness. 2. Corticosteroid eye drops. These are stronger than artificial tears and can reduce inflammation more quickly. 3. Nonsteroidal anti-inflammatory drugs, NSAIDs. If you're dealing with recurring episcleritis, oral NSAIDs may help manage the inflammation. If episcleritis is tied to a larger inflammatory condition, treating that underlying issue can also help reduce flare UPS. But for most people, it's simply a matter of patience letting the inflammation run its course. When should you worry? While episcleritis is usually a mild, self-limiting condition, there are times when it's important to keep a closer eye on things. If the redness is accompanied by severe pain, or if you notice changes in your vision, these could be signs that the inflammation has progressed to something more serious, like scleritis. Scleritis, as mentioned earlier, is more intense and can lead to vision problems if not treated. That's why it's critical to pay attention to your symptoms and seek medical advice if things feel off. Final thoughts. Episcleritis may not be the most well-known condition, but it's surprisingly common. It's also manageable and, in most cases, not something that will affect your vision in the long run. The redness and discomfort can be frustrating, but understanding what's happening inside your eye can make all the difference. It's easy to jump to conclusions when something doesn't feel right with your body, especially your eyes. But with episcleritis, the problem, though inconvenient, is usually temporary and mild. So, the next time you look in the mirror and see that unwelcome redness, you'll know exactly what it might be and how to handle it. In the end, taking care of your eyes isn't just about avoiding problems like episcleritis, it's about staying informed, so when things do come up, you're ready. Remember, our eyes are incredible organs, and even when they're inflamed or irritated, they're resilient.